Hello, everyone. Welcome to today's session conducted by Indian Behavioural Economics Network. Today, we will be exploring the application of behavioral sciences in the social science sector. And I would like to welcome our speakers today, Cheshta Kochar and Diksha Radhakrishnan. So our first speaker for today is going to be Diksha. I wanted to start by a little introduction about her. So she's the Deputy Director at Center for Social and Behavioral Change, CSBC, and she leads the Center's Behavioral Design and Impact Lab. Previously, she's served as the CSBC's founding lead for establishing the Behavioral Insights Unit at Niti Aayog, where she has worked with several high-stake behaviorally driven projects for the government, which included a communication campaign to promote mask wearing. She's also worked as the PM's Rural Transformation Initiative in Varanasi and generation of evidence-driven solutions for improving nutritional practices in the rural communities. She has extensive experience in the domain of applied behavioral research and scale program design and operating in the public health landscape. She's also previously worked as Evidence Action Kenya and was responsible for identifying, designing, and scaling evidence-based solutions with government partners across East Africa and South Asia. We are really, really glad to have you here, Diksha, and we look forward to an insightful session from you.
Great. Thank you, Havishi. Thank you for that introduction. I'm happy to jump right into the discussion, and I'll share my screen. Great. I hope that is visible. I just hope the presentation mode is visible. Great. Okay. So great. So firstly, thank you to the Indian Behavioural Economics Network for this opportunity to kind of talk about some of this, about the application of behavioral science in the social science sector. So I particularly interpreted this topic, and there's so much that can get covered under this topic of discussion, but specifically looking at the aspect of how do you even design behavioral solutions, right? So thinking of this from the idea of behavioral science as a larger kind of ambit a larger ambit of science is something that now is actively used in policy strengthening and in various forms of, in various aspects in the social sector. So how do we even, before we go into that, which anyway my colleague Cheshta will be covering, I wanted to think about how do you even come up with these interventions and solutions which take into account and apply behavioral science into its conceptualization. So going right into it, what primarily I look to cover today is the concept of behavioral design and the process that goes behind even developing behavioral solutions. And then specifically talk about some of these forms of the behavioral solutions that have come out, right? Looking at the 3N of nudges, narratives, and norms, and I'll dive into each of these specifically to talk about what these forms are through case studies of also work that was done by the Center of Social and Behavior Change, and kind of wrap it up in terms of some key aspects to keep in mind as you think about behavioral solutioning as well. So that's looking at these two aspects. I want to first start by even explaining what is behavioral design, right? So this is a key, behavioral design is a key tool that can really help us design effective interventions for various types of developmental challenges. Behavioral design as a concept looks at mixing and combining the scientific rigor of behavioral science, of what we know from the larger literature of the way decisions are made and how kind of biases exist and how we even address this, with the empathy and flexibility of design thinking. So design thinking as such is also a very up and coming emerging area of how do we even start thinking of solutions, and the aspects of emotional design, human-centered design have really taken center stage. So behavioral design tries to bring these two aspects together to really understand the how and why of human behavior, but looking at it from both from a flexible design approach, but with the rigor of the larger scientific aspects of behavioral thinking. What such a combination really helps us do is it helps us resist acting upon assumptions. So when we go into solving any kind of larger developmental challenges, we go in with certain assumptions which behavioral design questions, right? So when we go in, a lot of times you will look at, say, oh, awareness is low. People don't do this because they're not aware, or people do this because of XYZ reason. What behavioral design does is it actually makes us stop and reflect upon those assumptions and relook at where we are starting from and what's really happening. It helps us reframe questions in more human-centric ways. So not just stopping as information is low, or stopping at the aspect of people behave in a certain way, to actually relook at what are some of those underlying causes, what are some of the human behavior aspects which are driving these particular kind of outcomes of, say, people not wearing masks, or of people not getting the children immunized, right? We tend to not just look at it at a one layer, but look at it at multiple levels of knowledge. What it also does is help us understand the larger context and culture. So of course, we are not looking at all of these in isolation, but looking at these as seeped in certain cultural and contextual norms. And how do those influence our decision making, and how when we look at larger design or behavioral interventions, we can't kind of design in isolation. And this is why design thinking plays a big role as well in helping us understand those user experiences, those larger kind of norms that come into understanding how someone engages with various products. And then also, because of us being able to think differently, articulate ourselves more clearly in human-centric ways, what it also helps us do is explore new alternatives. It helps us kind of think more innovatively, think of ways of doing things in unconventional ways rather than what we've always been used to. Now, a key way to think about behavioral design is to think of it as a method. So we get quite, how these are large concepts of behavioral science and design thinking. And how do we really? So when you want to apply this, the best way to think of it is a very detailed method. Now, this is something that at the Center for Social and Behavior Change, we very actively use for all of the varied work that we do. So, and this is something that has come out of a lot of trial and error. It's not something that just happens, or we thought of this process and it's beautiful. It's taken a lot of learning at our side as well to how do we really think of this, and that learning is still continuing. When you think of the process, you start with what we call discover. So really start with thinking about diagnosing a particular developmental challenge, understand what is happening here, explore what the different decision-making pathways are, what is the larger policy and environmental context within which these behaviors exist, who not only looking at the person who we are targeting for a certain behavior, but looking at all the all the accompanying actors of that particular behavior, understanding how they feel, what their attitudes and beliefs and knowledge is around that behavior as well. And then using all that information to, of course, define what your behavioral objective is, what your behavioral pathway is. So this is again an iterative process, because you keep learning and going back and relearning, and finally, at the end of it, you come to a point where you've identified a clear behavioral entry point, which you think is going to help in actually solving this larger developmental challenge. And this step is absolutely crucial in articulating what your real problem is. So you go from a meta challenge of, say, you're trying to improve or you're trying to reduce, say, children, the underweight children in the country. Now, that's a very meta problem. And what this particular phase helps you do is to articulate that and break that down into more core behavioral problems that you can start targeting. The next phase is, of course, design. Design is the aspect of where you actually now take the particular problems that you have articulated and said these are the key behavioral objective that you've articulated, and start thinking of ways to actually solve this through various forms of solutions. Now, these could be solutions which are product focused or communication focused, could be even system optimizations or process optimizations. They could be of varied forms. So a key challenge, of course, of when you work in the policy space, or when you think of behavioral solutions, it tend to get narrowed down to thinking of behavioral change communication solutions. So this is an important phase of how you articulate your problem, so that you can also then look at solutions which are larger in scope. So this is where you look at ideating what your solutions are, and then you go through a process of then refining and iterating those solutions till you come to a set of solutions that you feel confident enough will have impact in solving the particular challenge you're looking at. And a key thing here is when you think of ideating, this is where the behavioral science element plays up, because you're able to look at specific forms of behavioral principles and pathways that have been validated through various, from the scientific literature, and look at how those can be applied. And then the design thinking helps in terms of the iteration aspect of how do you kind of take those concepts and create them in forms that will have the greatest engagement. Now, usually when we think of design thinking, we usually stop at the point of design, but with behavioral design aspect, you definitely want to go into the next key phase, which is evaluate. You want to validate your interventions to be able to actually have evidence to say whether these are achieving the desired behavior that you're looking at. And this is a core concept, especially from the behavioral science element, to build a proof of concept for your solutions and be able to say whether they've achieved and are actually going through those particular behavioral pathways that you had outlined them to. And when you're working in the policy space, and the next step of advocating and ensuring that this evidence and this knowledge actually turns into larger at-scale solutions for generating impact also become highly relevant. So from this entire process, what we look to gain is bring together deep behavioral insights with design innovations to create solutions that are both tested and engineered for scale. So they're not just stopping at solutions which we think are interesting or which we feel can actually help, but there is validation to know that they are actually effective and that they also can be applicable at scale. Specifically, what we will focus for today, and I'm not going to go into the evaluate and advocate aspects, and maybe I'll look to Cheshta to, of course, talk about some of those advocate aspects as part of her 15 minutes of discussion. But what I would want to focus on is on the discover and design elements specifically. So when we do discover, this of course takes forms, and the steps that go into this sort of, looking at secondary literature reviews, looking at data, looking at conducting primary diagnostic research yourself. But what we really want to get out of this is a root cause analysis to be able to identify what are some of those choice architectures and mental models and biases that are going into this particular behavior. What are some of the larger influences and norms? And like I mentioned earlier, the larger context within which the behavior operates. That's when by the end of a discover phase, this is what you really hope to identify. And then when you go into the design phase, what you're looking to do is, of course, facilitate ideation, look at it from the idea of design research of how do you move from a concept to its final form of which actually is delivered and the larger audience engages with. And the whole time of both the ideation and the design research, an important lens that you keep in mind is how does this finally work when you want to deliver this intervention at scale. So it's not something that you think about later, but right from the get-go, when you're thinking of solutions which you are approaching from the viewpoint of applied work, right? When you're looking at this from the viewpoint of how can these solutions finally create impact on the ground, it's important to keep that lens as what is even operationally feasible. Because at the end of the day, when you think of at-scale delivery, there is a lot of operational aspects that go into it, which then curtail what you can and cannot do. Now, shifting a little bit from looking at this behavioral design process to now what are actually some of those forms of delivery and what are some of those aspects that you really look into. I'll kind of go through this a bit quickly, but primarily looking at this in the one, of course, is a more popular aspect of nudges itself, right? So this comes from Taylor and Sunstein's great work around this area in terms of what really goes into creating a nudge. A nudge is any aspect that where it can influence a choice architecture to kind of change the way that a particular behavior is performed. These can be quite powerful in terms of changing a particular suboptimal behavior to an optimal behavior by creating very simple tweaks in that overall system. When designing a nudge, some key aspects to keep in mind is to, of course, keep it really simple, because there is a concern of the idea of errors and the idea of, if something feels too, if a particular nudge is too complicated, then there is a greater possibility of going back to the default of what you were doing before, than even kind of trying to manage yourself to the to the particular nudge you're introducing, to keep it quite salient and visual so that you can actually kind of draw attention to this particular element that you've introduced into the choice architecture, and that it maps very clearly back to the key kind of options to incentives. So by doing certain things, it maps it back to specific types of incentives that you have in mind, and it makes that very salient for you. And then lastly, it looks at how to, when designing a nudge, a very key aspect is to think about how it closes the intent to action gap. Because a lot of times when we think of nudges, we stop at the level of motivation or at the level of ability. But then how do you even think about creating that final kind of nudge to actually get them to perform the behavior? This is where aspects of giving feedback to help to kind of push them over and take that final step, or the right timeliness of placing a particular nudge at a point where you will see the highest kind of turnover becomes extremely crucial in how you look at these decisions. A quick case study that I will walk through of a nudge that we looked at the center was around the concept of IFA supplementation. So here we've seen this particular issue of there being very high number of anemic women in this country, and especially women who are anemic during pregnancy leads to very serious complications, both during delivery and then later for the child as well. So a key solution exists in terms of IFA supplements, which women are expected to take during their 6 months of pregnancy, starting from the second trimester. But we see that the adherence is very low. So when we did the discovery and diagnostic phase, we learned about a certain mental model that is at play. That is, anemia is not perceived as a serious health issue. The symptoms and effects are highly invisible to your target population. They don't see these as, these are, they get shadowed as symptoms of pregnancy or of other kind of causes. People don't particularly connect the two of the seriousness of anemia for other kind of health implications. So then what we looked at, from being able to articulate our problem more clearly, we were able to come up with a nudge of how do we even reframe the conversation around anemia. Can we now look at anemia? Can we kind of create a new mental model of calling anemia as a bimari, and then IFA tablets as a cure for that particular thing? Now this especially plays up when you think of the idea of curative healthcare norms being quite strong in the community, and the aspect of the fact of the larger culture where pregnancy is a very delicate time and people don't want to be considered sick during this time. So these two elements then also help us in setting this new kind of mental model. And what we looked at designing from a more visual point of a nudge is to create a hemoglobin scale card, so that when a woman is getting tested for her hemoglobin levels during various antenatal care visits, the frontline health worker can have a simple card which kind of maps her particular hemoglobin level to one of these specific categories. And what this does is, going back to the idea of being visual, there is an incentive already at play of having a healthy child and being healthy. So then you're able to map that back and say, look where you fall within that particular chain and how you are deviating from your own incentive. And this also is kind of then fits in well with the second kind of aspect that we looked at of visual is to look at a prescription format of when handing over the tablets to the woman, giving it to her with this format, which goes back into the norm of curative healthcare. And doing this at the right timeliness of when tablet is handed over also makes it more effective, because then you're actually doing it at a point when she's already getting the tablets, and it helps to kind of strengthen that decision making. Okay, now I need to be taking the tablets because this will get me closer to the green part of the card rather than at the red part. This is one form of behavioral solution we can look at. A second form, and I know there is so much to discuss on each of these, but for the sake of time, I'll kind of go through, at least give you an overview of these three to look at. The idea is narratives. Narratives is an extremely powerful communication tool that can really have a great have great strength in transforming behaviors. Narratives in its basic forms is stories, and we are all wired to think in stories. We engage in stories day in and day out. In most of our conversations, we are narrating or listening to stories, and this has been going on for centuries, right? So right from like even caveman, the idea of stories is what has always really helped us evolve our own attitudes and beliefs. And there is a growing literature around the power of narratives, both from the idea of psychology and cognitive neuroscience, about how stories help us in multiple ways. Three kind of reasons which I've listed here. One is it helps us make a sense of a lot of random information because it gives it a particular structure and makes it easier for us to consume it. It helps in reducing resistance towards the information that is displayed. So even if it is information that we particularly may not agree with, but when it is conveyed in a story form, it makes it easier for us to consume that information, and it slowly helps us in reducing any resistance that we feel towards it. And lastly, a very important aspect, we process stories the same way we process personal first-hand experiences. So what happens is we start to empathize with the characters. We start to empathize with what is happening to them through their trials and tribulations, which again goes back to the earlier point of them making it easier to kind of tune down resistance of what they are doing and feel and be able to feel, kind of relate more to information that is given. But now when we look at narratives of how do you even construct these kind of narratives, especially when you're trying to share educational information for targeting a certain behavior, that is a little more of a gray area as of now. I think that there is still, limited understanding of how do you build strong narratives and what really goes into that particular aspect. It's an area which the center is very excited to look at, and we are hoping to explore this further. But as of now, some key aspects to think of is even when you're constructing such narratives, how do you balance the entertainment and educational aspects, right? So that you don't look at this purely. One risk when we think of edutainments is we have at the face of it, it looks entertaining, but we go back to very basic ways of sharing information, which then risks of this not being actually an edutainment narrative, but it just being a fancier way of sharing information, and then those particular aspects don't hold anymore. When we think of narratives, there are multiple ingredients which go into it. What kind of, are we using cultural and identifiable icons? How are we emotionally engaging the audience through humor or through suspense, through drama? There's still, again, like I said, these are elements that we still don't know enough about, but these are important decisions to make when constructing a narrative about a certain topic. And of course, lastly, to think about what is your platform of delivery, the length of time that you have, because these then also impact your final narrative construction. A case study around this is the work that we did with BBC Media Action and Viacom 18 on a particular TV series called Navrangi Re. The larger context comes from poor knowledge and compliance of fecal sludge management. So with the Swachh Bharat Abhiyan, there's been a big shift towards, a big reduction of open defecation. But now when we think of these latrines at home, another problem comes in terms of how do you do fecal sludge management. And what we discovered is that there is conversations about this are absent. And the reason for that is two. One is, of course, no one wants to talk about shit. And that's just not an interesting topic of discussion, but also that the entire aspect of fecal sludge management is extremely technically heavy. And that, again, is not something that becomes easy to counsel people on or share information on. So a way that we then decided to kind of address this particular issue was to create an edutainment TV series called Navrangi Re, which tells an entertaining story about a mohalla. There are lots of different characters, a love story, drama, all of those elements. But at the backdrop of it, we are also able to weave in information about fecal sludge management as a storyline, which helps us not just share information, but it also helps us demonstrate practices of fecal sludge management. So this became a 26 episode series, which was aired on a primetime channel on weekends. And what we saw was that with greater exposure, of course, there was difficulties in measuring the actual impact of something like this, actually helped people in recalling the information that was shared and in helping them kind of understand some of the aspects of what goes into fecal sludge management. And you're also able to then mainstream these conversations and you're able to then talk about certain specific aspects of these particular practices, which in a normal counseling session become hard, like social tensions of not doing proper fecal sludge management because of smell, and what happens in a neighborhood because of that, and all of these different aspects that come into it. I mean, this is something that we see a lot even with mainstream Bollywood. When Toilet Ek Prem Katha as a movie was released, it led to a lot of conversation about open defecation, which otherwise was not something that people normally spoke about. So these can be a very, very powerful tool. The last one that I would talk about is norm nudging. So social norms as such is a form of behavior which we all conform to because we think that this is what we expect others to do, and it's also because we think that this is what others expect us to do. So by using this form and by trying to create certain behaviors into social norms, what we can do is actually drive them as strong behaviors where we don't then have to have more structural incentives and disincentives, because a norm itself acts as deviating from a norm itself acts as a disincentive for the larger population. So it helps us in actually then driving behaviors in more sustainable particular ways. So norm nudging as a concept is when we encourage a particular targeted behavior by eliciting social expectations. Now, the way that you can elicit social expectations is by either sharing information on what are empirical expectations, that this is what others are doing, so which then kind of drives the concept of then this is what even I should be doing. There's the famous experiment by Goldstein, which shows around how by telling hotel guests that other hotel guests are reusing their towels before putting them to wash, led to other hotel guests kind of following through with such behavior, because then you think that this is what you expect others to do as well. Or by sharing normative expectations, what you expect others to approve or disapprove of. There is also evidence growing on this, especially with like when you think of water conservation, by showing households how they'd kind of water consumption fared to a peer group, help them to also think of where their behavior was like either at par or below, and help to create a normative expectation around a certain level of water conservation. A key kind of concept when using such a technique is to, of course, understand the mechanism of the target behavior. This works when the target behavior itself is a descriptive or injunctive norm. That is, it is actually conditional on social expectations. It's not a behavior which is more fixed on moral aspects or on based on customs, because then those behaviors don't really take into account social expectations as such. There are lots of other aspects which go into building a good norm nudge, which is like what is the reference network you're looking at, what are messenger effects, how you frame them. This is a whole session in itself, so I won't go into all of that, but these are important aspects when thinking of design. An example here that comes from the work that we did with Niti Aayog on a larger and the Bill and Melinda Gates Foundation on this larger aspect of the COVID campaign on mask wearing. So here, of course, the key aspect that we wanted to look at is encouraging mask wearing to prevent the spread of COVID-19. Now, what we discovered, and this is again where it goes back into understanding that larger context and aspect, is that we were at a time, this campaign was launched when the first lockdown was ending. So you were at a time when formal regulations were coming to an end, and there was a going back to normal life. But given that the pandemic situation was not coming to an end, and we knew that it is going to be long lasting, there was a need to kind of encourage a new normal behavior, because people are going to go back to their regular lifestyle in now a situation where formal regulations might not be as strong anymore, but the COVID situation exists. So norm nudging became a key way that we thought of kind of then encouraging this particular behavior. But here we focused not just on compliance of mask wearing, but looking also at enforcer behavior of mask wearing. So going back to what we were talking about in normative expectations, that it's something that how do you drive this behavior of looking at mask wearing, of how others kind of disapprove of you non-complying to the idea of mask wearing. And we thought that could actually have a multiplier effect, because when you are an enforcer, by default, you are also a complier. And by the fact of being an enforcer, you can have a larger effect in kind of convincing others to follow through with the behavior, because there is disapproval when there isn't someone following through with that. We did that by coming up with the strategy of what we call the 4R, which is one aspect of it is to take responsibility to encourage the norm, especially when formal institutions were receding, but also then to look at encouraging the norm by respectfully reminding and reprimanding others for non-compliance. And the respectfully part became quite important, because then we did not want this to cause any kind of conflict. So we came up with this campaign with this tagline of Mask Nahi to Tokenge, Karuna ko Rokenge, where the idea of Tokenge is the fact of that there is going to be disapproval if you don't comply to this particular behavior. And all of our posters looked at ways of, very tongue-in-cheek kind of humor of how when people don't comply, there is almost like an obvious disapproval of this behavior. But here we use children as messengers so that there isn't an aspect of conflict, and children make it easier to kind of push the boundaries a little bit in terms of humor or in terms of the way that we want to message disapproval for particular thing. So that was one of the ways that we looked at kind of how do you encourage this enforcing behavior for larger compliance for a particular kind of aspect. This is my last slide. I'll stop here. But of course, when we think of a process of behavioral design that goes into even building these particular solutions, and then we go into the aspect of what forms these solutions can take, we cannot ignore three key concepts. One is bringing stakeholders along. It becomes absolutely imperative that we take into account the key stakeholders we are working with across the board. This includes, of course, target populations that you're trying, who you are targeting for the particular desired behavior, whether these are policy stakeholders who need to be encouraged to kind of actually then endorse this particular solution, and also looking at other forms of players and other artifacts that come into this particular zone. So bringing stakeholders along becomes a crucial aspect to look at. Building strong proof of concept, so making sure that looking at ways of experimental and methods to actually be able to validate effectiveness of solutions. And lastly, what I already mentioned is engineering for scale. So not if we know something is effective, that is not when we should start thinking about how do we scale this and how do we look at it, because then it requires a whole different form of thinking, but making sure you take into aspects of at-scale delivery or policy integration, right from even your discover stage of what is feasible and not, so that when you have built your proof of concept, that step of advocacy and scale integration becomes a lot more seamless. I'll stop here and hand over back to Bhavishi.
Thank you so much, Diksha, for such a detailed view of, right from how do you ideate and then design the policy, and, just giving us so many examples from the work that you've done at CSPC and Niti Aayog. So before we move on to the next presentation, I just wanted to let the audience know that we would be taking questions at the end of the second presentation. So whatever questions they have, they can feel free to send in the chat box and we'll have the speakers answer them. So our next speaker is Cheshta. She is a senior advisor at the Behavioural Insights unit at Niti Aayog. She is a policy strategist and she has extensive experience in designing and scaling national programs for global institutions, including McKinsey, the Government of India, and the University of Chicago. She's previously led formulation and implementation for technology and governance projects in offices of the Chief Minister of Delhi, the Education Minister of India, and the Prime Minister of India, to note amongst others. She's also served as a member of the founding team of Aadhaar, leading last mile data collection and Aadhaar delivery to residents of India. We are so glad to have you with us, Cheshta, and I'd hand over the stage to you for your presentation.
Thanks, Bhavishi. Diksha, thank you for also educating me in the process. As Bhavishi has introduced, I'm not a behavior scientist, nor do I have a formal training. I do take a passion in understanding human behavior and route my work, but this was very educational for me. And as you can see why the work we do is in very safe hands when we have such a rigorous design process. I don't want to get into, absolutely, nor am I capable to get into the topics of how behavioral intervention may be designed, whether for limited capacity of a scale. I also had a chance to look at some of the previous IBEN webinars where speakers have come in to speak about how behavioral solutions can be taken to scale and what are some of the conflicting challenges or some of the conflicting factors to consider. I know Dr. Pavan Mamidi, the director of CSBC, was here. Sana from CSBC has been here. Then Ram from Final Mile. Everybody has talked about it. It's a topic of when are policy institutions going to adopt behavior science finally? And I see we've had sufficient conversation around the conflicting priorities of timeliness, that it has to be quick response, versus accuracy, that it has to still be rigorous and accurate. So, and I agree. So I wouldn't repeat that is a challenge that CSBC has also faced. Of course, Diksha was the founding lead of the Niti BIU, so she has faced it more than anybody else. So I think that is given that taking behavioral interventions or taking behavior science to policy is confounded by timeliness, short timelines of policy makers, as well as at the expected accuracy that researchers and behavioral scientists have around interventions. What I wanted to talk about, Bhaveshi, if you may allow me, is a concept that it's a consideration that the Behavioral Insights Unit in Niti Aayog has been kind of struggling with, and Dr. Shagato Mukherjee, who's the lead now, and we have been talking about this, that I think in this conversation of the fight between timeliness and accuracy, we've probably forgetting one of the factors that hasn't featured in the narrative of behavioral policy, which is of sustainability, right? And because I'm a nervous speaker, so I will use slides so that I don't go all over the place. But I think so. This is what we're talking about, right? Which is when we say timeliness, are we designing solutions in a timely manner? That's always the pressure. And then in accuracy, are we testing the solutions rigorously before implementing them? And I think this conflict has been, of course, talked about extensively on your platform as well. What we have been giving some thought to at Niti BIU is this factor of sustainability, which is, are we designing solutions that will last longer than we will? But that what I mean is, and just to put it in simpler language, when we say, are we designing solutions for them in a timely manner for policymakers, or when we say, are we testing the solutions before implementing them, there's still a factor of we and them, which is that we are the designers and they are the people who are accepting the intervention. And there is a lot of conversation around how do we increase the acceptance of behavioral solutions by policymakers. But what we've been at Niti BIU and CSBC, of course, talking about is not about how do we increase the acceptance of behavioral interventions by policy institutions, but how do we make behavior insights a habit of policy institutions, right? And of course, we have the benefit of brilliant behavioral scientists on our side. We can use this science for its own integration into the policy ecosystem. So that's the aspect, if I may talk about, which is how we are trying to approach this aspect, which is how do we design solutions that will last longer than us in the system. And an alternate way to say that is, how do we make behavior insights a habit for policy institutions, and a habit of the institution, not of people. What we have, and of course, again, almost using the framework that we always use, it's a very simple framework that we use to guide our thinking around this, which is the MAO framework: motivation, ability, and opportunity. Motivation comes from, motivation in the bureaucracy, motivation in the system comes from demonstrating impact consistently through projects. And I think the projects that Diksha has spoken about, the rigor of the design process, that's what helps us demonstrate this impact consistently. It also creates a set of available use cases that the system can refer to or the bureaucrats can refer to. But we look at projects as a very essential part of our work and demonstrating that impact. But we also look at it as one of the three things, which is it builds the motivation. But what is it that we are expecting the system to do once that motivation is there? Do we want them to come back to us and say, hey, these are new problems, solve it for us? Or do we want them to start looking at it themselves, start collaborating, and at some point start solving for them? And I think we're going for the latter. That can we look at policy institutions as owners of behavioral insights? So therefore, that's where the second two part comes in, which is ability and opportunity. When I say ability, is we build knowledge through capacity building programs that we are doing for the Indian Administrative Fellowship, the Chief Minister Good Governance Associates, and then of course we'll be launching it for people at Niti Aayog as well. But we're also giving them handy toolkits, and this is something that the team is working on, leveraging from the expertise at CSBC, but also leveraging from the expertise which exists around the world, where solutions have been created, and can we collate them and templatize them in a manner that they are easily usable, and along with instruction guidelines and usage guidelines. Again, what we are trying to, we're using a behavioral principle in our favor, which is creating salience. We're making it readily available, and we're building that ability in the system, again, not necessarily in select people, but in the system. And then we've at BIU stepped back and questioned, once the institution has the motivation and the ability, how are they going to affect behavior change in policy impact? And that's when we kind of talk about opportunity, which is institutionally creating spaces in the existing mechanisms, whether it's processes or structures, for the system to be able to translate their motivation and ability into usage of behavior insights. And to give you a very crisp example is the Government of India uses something called the framework, which is the Output Outcome Monitoring Framework. It's a standard M&E framework in which each program's outputs and outcomes are defined. So visualize it like a 2-column table, and there's outcomes and outcomes. And through various touch points, what we've been trying to do is insert a column between outputs and outcomes as that of desired behaviors. Right? That what is it that what are the behaviors needed to translate the outcomes to outcomes? Did we need to alter the format of a government document for that? No, we can easily do that for our own projects. But the reason we are doing this with a very clear understanding that bureaucrats for the first 1, 2, 3 years will probably reply saying not available or don't know what you're saying, but it compels them to think about this term, what is desired behaviors? How is it linked to outcomes? How is it linked to outputs? Right? And at some point, institutionally, will they start filling it and start thinking of these aspects as they think of policy altogether? So that's what we mean by opportunity in the system, that once the system is excited, motivated about behavior insights, which demonstrative impact will lead them to, once they are able, with the requisite knowledge as well as the requisite toolkits, do they have the opportunity to then affect it? Right? And I think these are the 3 core pillars on which the BIU works, and also, if I may take the liberty to say, works differently than some of the other behavioral insights organizations in the country, which is, of course, we are very focused on solving very focused indicators and focused problems, but we're equally focused and on addressing this question that has not yet come up as a conversation in the circle, which is how do we institutionalize behavior insights in policy ecosystem, and because it's my punchline, so I will end it with that, which is how do we make behavior insights a habit of the institution? And I do want to iterate, I'm not saying a habit of the bureaucracy, and nor am I saying a habit of the parliamentarians. I'm saying how do we make behavior insights a habit of policy institutions? And I think that's where we use this rather simple framework, and this is the framework that guides our work with some of the examples. Of course, Diksha has spoken about the projects in detail, so I wouldn't go into that. But I did want to bring it to this passionate audience about behavior science to kind of maybe start thinking about this aspect as well. That's all from me actually, because we do want to receive questions, and we are ahead of time. So thanks, Bhaveshi, and thanks, IBEN, for having me here.
Thank you so much, Cheshta. It's really exciting to know the kind of development that's happening in India surrounding behavioral economics and the policy, and to know that Niti Aayog is taking strides and coming up with very original approach when it comes to policy. So now I would like to open up the space for the audience to ask their questions. So we had a question for Diksha. Shashank wanted to know some real world examples for nudging behavior, which you've previously used in your projects.
Sure. I mean, there's a wide variety of behaviors that we work across. Specifically, I could talk about two very exciting projects. I think one which Dr. Pavan Mamadi spoke about last time, which was about complementary feeding as well, which is also about this is basically getting kids weaning off breastfeeding and starting them on solid, semi-solid food from the age of 6 months till 23 months. And complementary feeding is a very technical concept, right? So it basically, when we say that a child should be fed a minimum, the behavior is that a child should be fed a minimum adequate diet, which means that they should be fed a diverse meal of at least 4 food groups. And the idea that the meal should be fed 4 times in a day, it needs to be of a certain consistency, and it then needs to be also of a certain quantity. Now, how do you drive such a specific behavior, and where did we, and which is so technically heavy? I think the one thing that we learned is that no one thinks about food like this. We think about food from the idea of what is delicious, what emotionally, a lot of cultural aspects, what is comfort food, junk food. So this became an interesting aspect of then how do we change the way the food is itself talked about in some of these conversations around complementary feeding. And also we realized that there isn't much conversation about food among different households. It's a very personal activity as well. So what we looked at designing was a way to encourage conversation around complementary feeding, but doing it in ways which kind of move away from the technically, jargon kind of language. So we created these WhatsApp groups of women, and we had to do WhatsApp again because of the pandemic situation. And there, over the period of 2 weeks, we gave them a lot of various forms of thinking about complementary feeding, whether telling them about talking to them about ways of how you feed. You don't just feed the stomach, you feed all organs of the body. So think about using different diverse meals to kind of feed those diverse organs. Or we gave them ideas of don't feed your child as a sick adult who only eats khichdi, but feed your child as a healthy adult who eats various forms of food. So by giving them some of the mental models and giving them a space to kind of question and to either hear from others or see an approval or disapproval of certain messages, what we saw by the end of the 4 weeks of treatment deployment, we saw that there was there was an increase in the practice of feeding, not just of feeding minimum adequate meals in its technical concept, and also specifically of also increased frequency of meals being served. So this kind of was a clear way of changing the way of conversation around a particular topic and looking at various forms of mental models that can help in changing choice architectures around decisions, and also looking at, of course, peer effects and all of those coming in to build a way of motivating a certain behavior. I'll actually stick to this one and not go in the second one for allowing for more questions.
Cheshta, would you like to add anything to that?
I never speak behavior science in front of Diksha. She's the expert here.
Oh, that's too kind.
So our next question is addressed to Cheshta, but Diksha, please feel free to add your insights too. So Mohit wanted to know, in a bid to institutionalize behavioral insights and make it habit of systems, how do you ensure checks and balances so that the nudges do not metamorphize into manipulation?
That's a good question. That's a good question, actually. I think there it's more on the question is more on the intentions of the people who ultimately end up owning the behavior change process. Equally applicable on us then. There may be some institutional checks and balances in that, very, very clear definition of, I'm not sure if you can hear me because my internet is unstable. Can you hear me?
Yeah, you just cut out for a little bit.
Okay. Okay. I hope not on the right portion, but I think checks and balance. See, it's a question of intention, is what I was saying, which is equally applicable on us, whether we are doing behavior change or we are doing manipulation, right? So it's on the intentions of the owner of the process, one. But there are still checks and balances possible in institutional checks and balances in terms of very clearly understanding and aligning with and making it a public knowledge in terms of what are the outcomes that we are changing behaviors for. I think so that kind of alignment of what is the direction towards which behavior change is being effected towards, as again public disclosure, but also alignment across different stakeholders within the institution, which becomes a mutual check and balance, is one of the things that comes to my mind as of now. But that's a good question for even the behavioral insights unit at NET to think about. So thank you for that.
And I would just add one more thing. I think it's a great question because
thank you so much, Ishta. Sure, Diksha, go ahead.
Yeah, no, I was just going to add one thing. I think it's an absolutely valid question that all of these aspects, especially in current contexts, can become kind of pathways for other forms of manipulation. But I think again, this is where building a strong proof of concept of what is it that these the solutions you're looking at, what is it that you're actually driving, and understanding what those measures are and seeing what really is the effect you're looking at, and ensuring that that is built into your system of knowing what that is before you endorse something. Then also worked as part of the checks and balances to make sure you're driving the right desired behaviors and not driving behaviors that that come from other adverse intentions.
Thank you, Diksha. So the next question is for both the panelists. So how does one deal with the seemingly paternalistic attitude which the behavioral design methods ensue, especially when the initiative is aimed at empowering individuals? So how do you overcome this paternalistic attitude which most of the behavioral design methods have?
Let me get the question right, if I have, which is the question that the design of behavior change interventions is innately paternalistic, and how do we overcome that?
Yeah, that's the question. And I mean, when these designs are especially directed at empowering individuals, so how do you overcome these paternalistic attitudes which some of the methods are inherent with?
I would probably have a follow-up on as to how are they paternalistic, but Diksha, you're the better judge here.
I think one of the ways, then at least the way I've understood paternalistic, is us as behavioral scientists or researchers or behavioral designers kind of driving some of these change. And I think for target populations which might be far removed from us, and there might be multiple degrees of separation. And I do think that's an extremely important aspect to kind of consider in design. And that's where participatory solutioning becomes an extremely important step in a design process. So it's not of us sitting in our conference rooms and coming up with ideas and solutions, but ensuring that you are actually working with target populations to come up with solutions. At the end of the day, people know best how to solve their problems, even if they don't always act upon it. So how do you kind of help and ensure that your design and ideation processes have that voice in that room and have that kind of insights as part of it, so that it's not just coming from your, far removed aspects of what people should do and what they look at. Yeah, that's what I would drive it. Of course, there's also paternalism coming in then from policymakers, a very different form, which Cheshta, of course, would be better place to talk about. But I would say even that form of paternalism becomes very important to kind of address and make sure that it doesn't seep into your final solutioning. And of course, ways to do that is that's where I think even articulating your problem and being quite thoughtful in how you're bringing that up helps to provide that space for innovation and thinking, and not go back into more conventional solutions.
I think one of the
Krishna, would you?
yes, thanks
Sorry,
for
go ahead.
no, thanks for explaining the question. But I think if I may, address it from a perspective of how the field may be paternalistic or monopolistic, so to say, in terms of creating solutions vis-a-vis stakeholders, which is in that, are we exclusionary to stakeholders, whether it's last mile recipients or our partners like government, to say we are the behavior scientists, we know human behavior. I think one thing, at least, and I'm of course only best placed to share what we do to avoid this, so not getting preachy at all, is two things. One, something that our director has repeatedly shared, and we try to imbibe that very closely, is that you don't need to have studied behavior science to understand human behavior. And you'll see, I'm not a student of behavior science, but still managing somehow. But I think we also walk in terms of creating solutions with our stakeholders with the same attitude, that they may not know the language of the field, but that is not the same as them not knowing what they're talking about. And I think we are very aware of that if they're saying something which is coming from an intuitive place, and if they can't put the formal terminology, we fill the gap with the formal terminology. So that way it bridges the gap in terms of how their ideas are received by this world, but also in terms of how they gradually start feeling confident about being able to use this language, which is what at the end of the day, of course, there are nuances. I'm not suggesting that anybody can design behavioral or nuanced behavioral interventions, but that's not to say that anybody cannot contribute to it, and we are kind of very, very cognizant of that. That is one. Second is also, I think, as Diksha explained, the process, right, which is of behavior change, the behavior intervention design. If you'll see, there are also very explicitly parts where different stakeholders come in, almost in a structured manner. So there's also pre-discover that NITI BIU, for example, at CSBC does, where we map the ecosystem as to what are the ring fencing boundary conditions in which we'll work, right? Which is kind of almost like a behavioral audit of the ecosystem in which we're working in. We also work closely with Diksha's team to be able to come in with perspectives on feasibility and scalability, right? And then that's not to say that once the intervention is closed, that then they don't work with the BIU, right? Or we also need insights from behavior science to be able to take behavior science to people, right? So I think it's such an integrated process, at least at a stakeholder level. And then similarly, as Diksha is saying, the same process with citizens as well, and as we are designing solutions.
Thank you so much for that, Cheshta. Moving on to the next question. So when you talk about using communication and behavioral design, so how do you evaluate the efficiency of your behavioral designs when it comes to looking at achieving the desired behavior?
So there is, I mean, at the center, we of course use experimental research methods to be able to actually validate the effectiveness of the interventions that we design, whether that whatever form that they end up being, and these could be, and we look at what we might call lab and field or field experiments to be able to actually understand how specific solutions work with target populations, how when they are delivered within real world settings, how does that kind of change the way that they are engaged with, and then actually measuring as close as we can to the desired behavior, or if not the desired behavior itself, to be able to build that proof of concept. Now, experimental research in itself is a whole topic, but there's a lot that goes into thinking about what is the right method, what are the right outcomes to choose for, what are the protocols to go into it, and there is a lot of rigor and a lot of thinking and technical aspects that look into this kind of design. Of course, you could also build, I mean, for us at the center, we do believe that this is the key kind of proof of concept to have, which actually helps us understand causal effectiveness of the interventions. But that being said, even as we, there are also opportunities where, to what Cheshta was talking about, when you look at timeliness versus accuracy, where there are also times where you might want to be looking at where can I get more, do some more rapid experiment where I can take a bit more pragmatic approach to testing for us to still have some evidence to be able to suggest something. So there's a whole gambit here, and I'll stop here because this could be another hour of discussion on how do you even think about experimental methods. Though I do think the previous webinar of IBEN on this will cover some of this quite well.
We'll just conclude with one last question to the panelists. So the question would be, how would you approach a problem if it's an existing problem, if you're designing a policy versus a new problem? So for example, if there have already been policies which have not proved as effective, so how would the approach differ in that?
May I?
Yeah, go ahead, Krishna.
I think it's, again, good question. Ideal situation for us is new policy, so that just less baggage to deal with. But actually, old policy is good in the sense that we know the ecosystem we are operating in, we know our boundary conditions, and we know precisely what has not worked. Vis-a-vis a new policy where we are walking in with a lot of unknown variables, so to say. More strategically, I think it's also in some ways the negotiation table is more open in an ongoing policy because the stakeholders' skin is already in the game. It's an ongoing policy, the results of which reflects on someone's success or failure. Whereas a new policy is not yet a matter of concern to anybody. So there we have to convince people of the importance of it, whereas on an established policy, the importance is already established, right? In terms of exactly how we go about it, I think the process-wise, it's similar in terms of how we'll probably approach a problem like when Diksha shared IFA, it's an existing problem. When right now we are working on something like a Jal Jeevan mission, that's a new policy. There's not a vast amount of difference in how we are approaching the behavioral component of the problems. Again, the difference being in Jal Jeevan mission, for example, we are defining the problem itself in the policy, which is if this is the overall end goal, then how do you kind of chunk it into specific behavioral challenges? Whereas with anemia, the problem already existed. There was a solution which was tested, and therefore some narrowness to what the behavioral challenge was. Right. So I think so. But after that stage, once we've gotten to whether we're defining it ourselves or whether it's given to us, I would think broadly I've at least observed for the teams to be adopting a similar approach. But here is where the expert should speak, which is Diksha.
Cheshta, I think you're as much of an expert, but I would just add, I think you've pretty much covered the answer there. But I would say that just one more thing is that when it comes to a new policy, there is definitely more of a playing ground. So there is more of aspects you can explore and more kind of ability to try and because your system aspect is getting designed with the behavioral aspect, so there's more chance of actually building a more integrated kind of program, rather than like what ends up happening a lot now is we're thinking of behavioral design as an afterthought to programs which have focused more on supply side aspects. So I think that way trying to bring the supply demand aspect can become a lot more integrated in something when it's a newer policy. But when it is something that is there, of course, there's more knowledge there. When it's an older policy, there's more knowledge of how people already behave in a certain setting, what has worked, what is the way that people interact, what. So there are trade-offs within that, and how do you work between the two, which I think makes it an interesting challenge in both cases to really look at.
Thank you so much, Jeshta and Diksha, for that. So I think now that we're running a little over time, unfortunately, we won't be able to answer any more questions. But I would like to take the opportunity to thank Jeshta and Diksha, both of you, for joining us today and giving us so many insights into how policy works, right from designing it to the implementation, and giving us such in-depth and rich data with real-life examples that you all have officially worked on in India. I'm very sure that this is going to inspire a lot of people to just get a better understanding and, further take up policy making using behavioral science. So I would also like to thank the audience for sending in your questions and for joining us today.
Thanks, Bhaveshi, and thanks, Payaswini. Is it right? I really want to get this pronunciation right. No, thanks so much. And it was a very enlightening discussion. And what a great note to end it on, what Diksha said, that behavioral insights can't be an afterthought to policy solutioning. And I think that's the core with which CSBC and Niti BIU is running in the country, and hopefully this session will encourage people to not take it as an afterthought. But thanks for having us.
Great. Yeah. No, thank you for having us, and it's been a great experience, and I'm glad I got to do that with a colleague of mine, Jeshta. So I look forward to kind of continuing to engage